Okay, good evening, everyone, and welcome to the Gyaan Vardhini session number 21. I'm Anand from CleanSav team, and I thank each one of you to join us today as we embark on yet another enlightening journey of wisdom and knowledge enhancement. Before we begin, I would like to share a brief overview of our amazing CleanSav app that we have developed over the last 6+ years. CleanSav means clinic savvy, and it is the only mobile-based clinic management app in India that allows you to manage your clinical practice in a full or 100% offline mode. It has a very simple design. CleanSav helps doctors easily manage patients, appointments, case papers, full prescriptions, bills, fees, issue of pre-filled letters, manage finances, and doing follow-ups with patients for any outstanding dues. CleanSav also sends automated appointment reminders 1 day in advance to your patients through SMS, and it also gives you the ability to simply swipe and send custom WhatsApp messages to your patients. Now we shall start with our today's webinar. Our today's webinar topic is ozone therapy and Ayurveda for wound management. Our distinguished speaker for today is Dr. Rajeshwari Buch. Dr. Rajeshwari is a Mumbai-based Ayurvedacharya with over 31+ years of overall experience in practicing in Goregaon West, Mumbai. She completed her graduation studies from Gujarat Ayurveda University, Jamnagar in 1988. She has also done her postgraduate diploma in Ayurveda nutrition from Scientific and Technical Education by Central Government, Delhi. Dr. Rajeshwari has worked as an ozone therapist since the last 11+ years, and she has treated various types of modalities. She worked as an RMO at Surat General Hospital from 1989 till 1990. She worked at Mahavir General Hospital in various departments such as the surgical ICU, ICCU, pediatric ICU, etc. from 1990 till 1995. She guided a research project on effect of rapid heal in MRSA at National Burns Center at Powai, Mumbai in 2018. Dr. Rajeshwari has contributed her expertise for OPD treatments of patients at Venus Medical Center, Shri Sai Hospital, Vivanta Hospital for an overall 20+ years since 2005. She is a faculty member in Advanced Ozone Therapy Training Program from 2018 till the present date. She has done multiple certification courses on ozone therapy basic and advanced by OFI from 2010 till 2012, IV Nutritional Therapy by Prism Academy, Frank Schellenberger Workshop on Prolozone in 2016, Basic Life Support BLS and Advanced Cardiac Life Support ACLS in 2017, Integrated Diabetology in 2018, Nephrology in 2020, Applied Panchakarma in 2021, Diabetic Foot and Peripheral Vascular Disease PVD in 2021, and Yoga Certification Body YCB Level 1 under Ayush Government in 2022. Dr. Rajeshwari has done multiple presentations on various topics such as multiple disabled children in 2012, healing of tissues in 2015, wound healing and autism in 2016, wound healing and multiple disabled children along with Ayurvedic approach in 2018, ozone therapy to World Federation of Ozone Therapy in 2018 and 2019, and osteoarthritis in 2018. Dr. Rajeshwari, we are honored to have you with us today to conduct this webinar. Let us all welcome Dr. Rajeshwari Buch for today's session. Dear ma'am, you can start with your session now.
Okay. Can you hear me?
Yes, ma'am, I can hear you.
Thank you for such a wonderful introduction, Mr. Anand sir. I am super excited today to present on this prestigious platform.
Thank you, ma'am.
Let us start. Slides are moving, no?
Yes, ma'am, I can see the slides moving. Yes,
Slides,
ma'am.
okay. Let us start this session with blazing of Bhagwan Dhanvantari. What is ozone? You all must be knowing about it. Ozone is present in atmosphere at the level of in stratosphere at the height of 25 to 30 kilometers from Earth's surface, which prevent us to ultraviolet rays, which is very harmful to our body. Like ozone help us in atmosphere and when there is a pollution in atmosphere, so ozone layer descend to trying to curb this pollution. So that way, yatha pinde tatha brahmande, it is a famous quote, and same way it is helpful to our body. So how we can use uh, in our body through various application that I will share in the PPT. This is the ozone blanket, ozone in nature. Why integration? So integration, you all know, this is era of autoimmune disease. This is era of obesity, PCOD, diabetes mellitus, lot of non-communicable disease due to air pollution, contamination of food, contamination of water, and big alphabet stress. So to overcome all this pathology, we need to apply multiple approach. So that is why integration is required. What is ozone therapy? Converting pure medical grade oxygen into ozone and using it in the treatment of various diseased condition is called ozone therapy. So you can see the machine and cylinder. It's a quite handy device and portable too. So we can take it at home side and we can give home visit also. It is very simple device. So why integration with ozone? Why I have choose ozone therapy with my existing science. So it's a natural drug. Judicious use does not harm. It is cost effective also. It is in Ayurveda term, it is Yogavahi and can be combined with any therapy. Whatever the therapy you are giving, homeopathic, Ayurveda, naturopathy, Tibetan, whatever, you can integrate with ozone and it gives synergistic effect. Being a Ayurveda consultant, I am using integration with Ayurveda and first I detox with ozone and then I give Ayurveda treatment. So I get result in three folds. Can be used as a preventive, protective, and palliative care. It is a versatile molecules. So you can use where you want to use according to your expertise. It is simple OPD procedure, doesn't require many rules and regulation and disciplines. There is no age bar. My youngest patient is 8-month-old baby, autism, and my elder one is 97 years. So there is no age bar. It is a major advantage of this therapy and beneficial for all system. It works on circulatory system, digestive system, uh, reproductive system, nervous system. It is beneficial for all system. So it is I can say it is a very smart and intelligent molecule. That is why I choose it. So ozone therapy used in almost 22 to 24 countries. First use of ozone in 1940. So I will go slightly. I won't get you in the deeper because I have to cover many cases, which is very interesting. And already we have a not much time, only 1 hour. I have to cover everything. If you have any question, you can ask me always after the completion of the session, or can WhatsApp me personally. So these are the route of administration, how we can give ozone. So this is brief introduction. Ear insufflation through ear, rectal insufflation, vaginal insufflation, minor autohemotherapy, major autohemotherapy. Later on, I am sharing the images of the each and every therapy. So this is a breathing ozone through oil. This is BOTO. It is very simple method. So ozone we cannot directly inhale because our lungs and endothelium is a deficient of antioxidant defense mechanism. So directly we cannot inhale. It applied through the ozonated oil. This is the bagging. So I am using this method for wound healing. It's a basic thing and it is basic procedure. Each and every wound I am using bagging, cupping, etc. This is ozone bath. So we can give steam sauna bath with ozone. It is a very rejuvenating muscle toner, and it is been used in extensive skin disease, for wrinkle reducing treatment, for obesity, for various purpose and rejuvenation. This is hair bagging. I am doing lot of cosmetic treatment along with my Ayurveda therapy. So it is a hair bagging for hair pathology like psoriasis of hair, hair fall, dandruff, etc. This is a subcutaneous injection around the knee for knee arthritis. It's a very simple method. Instantly, it's control the pain. This is a way of intramuscular injection for general body ache and pain. Now we start section 2, application of ozone. How can we apply ozone? Ozone application and their benefits. What are the benefits? So we are giving it to rectal insufflation, ear insufflation, minor autohemotherapy, major autohemotherapy, IV ozonated saline, and funneling. Today's our subject is to tissue healing. So I am using all this pathway for treating the patient. This is the image of rectal insufflation. It is given. It is a basic treatment. So it improve metabolism, immunity booster, antiviral, antibacterial, antifungal. So it is the base of my treatment. I am giving rectal insufflation in each and every disease. So these are the advantage of a rectal insufflation. Recording and slides will be shared to you, so we won't go in detail. This is ear insufflation, very simple method. Just uh, remove the chest piece and attach to the ozone machine through silicone tube, and you can wear as a stethoscope. And it is ear insufflation, which give calming effect in the brain because it secretes endorphin, which is a calming hormone. Disease which can be treated by ear insufflation. So we won't go in detail. You can read it afterwards. This is minor in autohemotherapy. So what we are doing, we are taking 5 ml ozone, 5 ml blood, mix it and give it intramuscular injections. So it's a good immunity booster. And I am using it in lot of in autoimmune conditions like rheumatoid arthritis, lupus erythematosus, IBS, Crohn's disease, psoriasis, hypothyroidism, etc. This is major autoimmune therapy. So ozone therapy given by 14 to 15 routes. I am using almost all routes except intradiscal, which is not my subject, not my realm, and I am not educated for it. And secondly, I am not giving ozone therapy through dialysis. So I am not nephrologist, but the rest of therapy, I can easily give it in my OPD. So this is a major autochemotherapy. What we are doing, we are taking 100 to 200 ml blood withdraw, heparinize it, mix it with ozone and reinfuse it. So it is very useful in many pathology like peritonitis, systemic viremia, diabetes mellitus, cancer, ICU patient, burns patient, and viral infection. This is ozonated saline. So what we are doing, we are develop this device. We are withdraw some saline and treat with ozone at 5 to 10 microgram per ml for 15 to 20 minutes, and then reinfuse to the patient through IV. So it gives rejuvenation, detoxification, liver disorder, and it has very good result in viral infection. I have treated so many viral infection patient like dengue, chikungunya. So it gives very good result in just 3 to 4 sessions. This is the funneling. So pilonidal sinus, fissure, piles, boils, small boils in back. So they are here we are uh, giving by funneling. So we are using various size of funneling according to size of the boil. Uh, Now, ozonated water. So locally used for infected wound. I am using for each and every patient for locally ozonated water or ozonated saline. For burns, it's very good result in burns. While we applying through compresses, traumatic wound, sprains, bruising, inflammation, fistula, fissure, bed sore, etc. It's a good energy drink. Instantaneously, it balance the acid and reduce the acidity. These are the product of ozone. We so various product available at Bisleri Charitable Trust. So I am using ozonated oil rapid heal for wound healing. So general indications are bruises, cuts, infected wounds, bee stings, insects bites, rashes, fissures, gingivitis, and oil pulling therapy for submucous fibrosis. These are the advantage of ozonated oil. Now, section 3, we are starting with interesting cases of tissue healing. So, what we can treat by this ozone, ozone therapy, diabetic non-healing ulcers, varicose vein ulcers, bed sores, crushed injury, trauma, for faster healing of wound. So we can reduce the period definitely. Avoid amputation and plastic surgery in selected case. And cherry on top, it is a cost effective. Even they are admit in hospital, in OT surgery, all these expenses we can save easily, and it can be done in peanut price. So this is a patient, 60 years of male patient, non-diabetic. Uh, Patient history is not available. Uh, Probably compartment syndrome. Later, I am sharing the images. So earlier he was admitted in trauma hospital at Jogeshwari. He has simple cyst or boils. We don't know. And some general practitioners has given some treatment, but no relief. So admitted in trauma hospital. There they have explored the wound, debrided the wound, but day by day it was deteriorated. So he took discharge in against medical advice and readmitted in Sri Sai Hospital, where I am attached on 20th February. So history is not available, but you can see wound. So it is quite evident it must be compartment syndrome. The wound is so bad. You can see severely damaged tissue. Tissue is non-viable. Foul smelling wound, lot of infection over it, and he was advised to amputate the amputation at the level of knee joint. But he readmitted in Sri Sai Hospital, and they refer for this therapy. You can see I have given this therapy at in operation theater. So Sri Sai Hospital honor is Dr. Shunil Chavan. He believes in ozone and believes in me. So he always used to give ozone before surgery and after surgery, immediate after surgery for better outcome. Before surgery for circulation. You can see that he debrided after ozone therapy. And here also multiple approach is applied. You can see not single therapy would be sufficient to address this complex pathology. So wet dressing, debridement in OT, ozone therapy, Ayurvedic treatment, diet, all everything is required. So once a wound is healed by ozone therapy, standard conventional treatment, so he was referred to the plastic surgeon, and plastic surgeon has put the graft because wound is so deep and it would take almost 6 months. But after plastic surgery, wound heal completely within 28 days. So it is possible with all this therapy, not only with ozone, not only with surgery, not only with standard conventional treatment, not only with plastic surgery. Because for plastic surgery, we need a healthy wound bed. So ozone's indication to prepare healthy wound bed. I have treated so many patients for and prepare so many patients for plastic surgery. Looking this wound, you can see it would take 6 to 7 months or amputation, only 2 ways. But within 28 days, it healed. So this is a 23 years female patient, cursed injury, while shutting down the door, admitted at Sri Sai Hospital, treat with ozone bagging along with conventional treatment, wound healed in just 2 weeks. You can see the images, quite evident. You can see this is the crush injury. So I have put this slide in my advanced training program. So stages 5, I am showing the stage of wound healing. So this is a hemostasis stage. This is inflammatory stage. So she was admitted in Sri Sai Hospital, and three options were given to this patient. One option is to cut the finger and stitch it. So there is a uneven length, and a finger would become deformed. So she has not opt for this way, this pathway. Second is to she has to uh, uh, plastic surgery. So you can see the middle finger, from middle finger, one flap is uh, taken and then stitch it. And she should leave 21 days in same position, but result is not so much good because of severe tissue loss. So what can be done? So she opt for ozone therapy. So सर ने मेरे को बोला आपसे हो जाएगा, मैंने बोला हाँ मैं कर सकती हूँ. So see the result. Within 15 days, along with the standard conventional treatment like antibiotic, anti-inflammatory, I have given only ozone bagging, nothing else. See the result. Tissue remodeling. This is a third stage of the healing. Completely heal this finger without any scar formation. So one of the benefit of the ozone is that there is a normal healing. What is normal healing? Dermis to dermis, epidermis to epidermis. So less chances of scar and keloid. So you can see nail is also developed within 6 weeks. So this is the miracle of the ozone. Now another case, 77 was admitted in Sri Sai Hospital for ozone and Ayurvedic treatment. Fibrillation. You can see the Museum of Pathology over here. He had COVID-19 infection for which he was admitted in Wokhad Hospital. After 1 week of discharge, he developed blue patches in both lower limb with severe pain. For that, he was investigated and found to have arterial occlusion in both leg, so both lower limb, and black fingers in toe of the left leg. So first amputation was done above ankle level. So he is my very old patient. He lives at Grant Road. I told him, give me chance. I can do with ozone, but relatives are not convinced. So first amputation was done above ankle level, but he developed gangrene and infection after 1 week. So second amputation was done below knee joint. Meanwhile, he had severe pain in right lower limb also. So left lower limb already amputed below the knee level. Same changes in both lower limb. So he had been told that okay, you have to amputate below the knee level because blue patch and ulcer in the second toe. I am showing the images. For that, he consulted vascular surgeon. After looking at his MRI, I am sharing MRI also. He advised amputation of right limb above ankle level But patient and his relatives were not ready for the same. So they consulted me and I admitted he in Sri Sai Hospital because I cannot go at Grant in Grant Road and give treatment. So मैंने बोला कि आप इधर ही एडमिट हो जाओ, मैं इधर मेरा अटैचमेंट है, मैं दे सकती हूँ for ozone and Ayurveda treatment. After 2 weeks, he was discharged and switched to maintenance dose. Color Doppler of both lower limb done on 18 November 21 showed complete occlusion of right distal posterior tibial artery. There is recombination of right dorsalis pedis artery with post-obstructive monophasic flow. So you can see blood supply is completely hampered. So these are the report. So this is the image before the treatment of right lower limb from dorsum view and from the posterior view. This is the result after treatment of 15 days therapy at hospital level. What I have given that I am showing you. Now patient is able to work with the one limb and he is a very good singer. So he is very happy with his life. Here I had given. You can see patient is very much confident and work with one leg. At least one limb could be saved by ozone therapy. Here I had given ozonated saline, bagging, ozone bagging, and some Ayurvedic medicines and vitamin C in high dose. So I am doing lot of IV nutritional therapy. So for that patient, I have given vitamin C also, and limb was saved. He is able to climb down the stair also. He is very bold. This is the another case, 104 years old female patient, history of surgery for right basal neck femur fracture in October 22. After surgery, she had a bed sore and hematoma of right heel due to foot drop. So this is a bedridden patient. As I said you, okay, this is a very handy device and portable device. So I had given this therapy at her home. This is my relative also. So I advise all the precautions and how to give ozone because this patient is in Santa Cruz. So it is no difficult to go every time for me. So I educate the patient's relative and they had given the treatment, sharing the image. This is a before treatment, this bed sore, 104 years old female patient. This is after even 7 to 8 treatment, she treat very well. This is foot drop, before and after image. Another case, 28 years old male was admitted in Sri Sai Hospital with crush injury while operating sugarcane juice machine. So severely damaged tissue and torn vessels with profuse bleeding. He was referred for ozone therapy after surgery at Sri Sai Hospital. Majority of hospital patient is from my from majority of patient from Sai Hospital. Hand was healed satisfactorily, but with limited range of motion, for which he was referred to physiotherapy. So I am showing the result, and I am showing another side of ozone therapy also, where it doesn't work. You can see before treatment, severely damaged tissue, non-viable tissue. And this is the image of before surgery treatment. They had done surgery for the same, but for circulation they were not sure, so for circulation and healing purpose they referred me for this therapy. And this is a after 1 week images. You can see first 3 to 4 sessions profuse bleeding, even uh, we had to give her blood also. So this is the after 1 week image. Uh, it took almost 4 to 5 days to stop this bleeding. And we all know that ozone is improve the circulation. But doctor tell me, don't worry, I want circulation. I can give blood transfusion, but you keep continue this treatment. So this is a stages wise improvement. Okay, I have put some goose piece in between two fingers, so it can prevent sticking from each other. Otherwise, adhesions will appear over here. So you can see the proliferation of tissue after 4 weeks. And there was a chances to amputation at the level of wrist joint, but instead of amputation at the level of wrist joint, only her his ring finger is became black. So take home message: ozone doesn't work in gangrene. So if there is zero circulation, there ozone doesn't work. But of course, you give ozone, so you can still achieve lower demarcation level. So you can save maximum part of organ. So here, whole hand is saved, but only ring finger was amputated. So by with ozone therapy and all standard conventional treatment, only ring finger become black and achieve lower demarcation level, just half finger. So one this ring finger was amputated, and he was referred for physiotherapy for movement. So here I will give you an ozone bagging, subcutaneous injection over interphalangeal joints to remove the adhesions. Total 25 sessions were given, duration 9 weeks. So take home message: ozone does not work on dry gangrene. Amputation can be avoided in selected case, not in all cases. We need to evaluate each and every cases. Each and every case is like a one book. This is another patient, 32 years old male patient, admitted in Sri Sai Hospital, accidental injury by side mirror of car on highway, Lonavala highway, due to which severe tissue loss in right thumb. You can see this image. So there is severe tissue loss. So in that condition, we can't stitch it. We can't do any surgery. So only one option is remain ozone therapy. So he refer for this therapy, and you can see the result. This is after 1 week image. This is after 2 weeks. Within 2 weeks, uh, thumb is totally healed without any surgery. So this is the benefit of the ozone. Here, ozone bagging, total 9 session is given, duration is 2 weeks. So take home message: lesser the age, better the result. This is another patient, 52 years old male patient, admitted in Sri Sai Hospital. History of uncontrolled diabetes. RBS was 500 milligram per liter with the acute exacerbation of psoriasis. Pus and watery discharge from psoriasis. You can see these images. They refer for this therapy after debridement. So you can see the appearance looks like a elephant yam. This is the I had given rectal insufflation and 10 sessions of the bagging. This is the image after 10 sessions. This treatment is given in bedside also, no? Bedside only. So after 18 sitting, you can see wound is healed. At the same time, diabetes was controlled by standard conventional treatment. And we can say ozone is also beneficial in autoimmune condition like psoriatic bone. This is another case. 56 years old female patient came in my OPD. History of surgery for lateral malleolus fracture, but surgical wound was not healed since 2 months. Referred to plastic surgeon. He advised to remove the plate. So this is a case of lateral malleolus fracture, and plate was placed by orthopedic surgeon, but wound was not healed. So he was referred to the surgeon, advised him to remove the plate, but orthopedic surgeon was not keen to remove it because the leg would be become deformed. So he referred for for this therapy. This is Dr. Ashwin Samant, patient, orthopedic surgeon at Goregaon East. So before treatment, I have given only begging because the patient was not keen to take rectal insufflation, but no improvement even after 10 to 12 sessions. So I had advised to take rectal insufflation, which is a systemic approach. At the moment I add rectal insufflation, wound healed within 1 week. So you can see the wound healed completely and not deformity at all. So orthopedic surgeon is also happy and patient is also happy. They both are happy and I am also happy. Ozone can be given in implanted joints. So take home message, you can give in implanted joint also. This is a case of another case of polytrauma with diabetes mellitus. This is 42 years old male patient admitted in Sri Sai Hospital. So history is like that. He was injured by sharp object by his enemy. So he was admitted in Kokilaben Ambani Hospital, went in crisis due to severe blood loss. So shifted in ICU, kept for 10 days and discharged with advice to come for daily dressing. So hemodynamically he was okay. But after 1 month, no improvement in pain in infection. So he was readmitted in Sri Sai Hospital. He was admitted in Sri Sai Hospital. There they have done some surgery. They explored wound again. They and some cementing work was done and meropenem injection locally injected with some materials. But they could control the infection, but not the discharge. Then ultimately they refer for this therapy, and I had given. Flushing with ozonated saline, ozone bagging, rectal insufflation. So earlier, when he was admitted in hospital, that time pus culture was sent for culture and sensitivity, and he was resistant to almost all antibiotic except one or two antibiotic, higher antibiotic. But after 20 session of rectal, biochemistry totally changed and he was his report was sensitive to almost all antibiotic including phenolines, cyprobid, norflox, like that. So we can say by systemic approach of ozone, biochemistry of the body can be changed by ozone. This is a multi-drug resistant staphylococcus infection. A 79 years old diabetic female patient was operated for fracture neck of femur. She was admitted in the hospital after 1 month of surgery for cellulitis on gluteal region, same site of operation. Her pus culture reports was MRSA positive. Either here, sorry for spelling mistake. It is a MR. Read as a MRSA positive infection. She was given ozone treatment in the form of funneling in high concentration rectal insufflation along with conventional treatment. Ozone oil was used for dressing rapid heal. After 12 sessions of ozone treatment, culture report was negative. WAC machine was applied on wound site for 9 days. Now wound is healed, but unfortunately I don't have last image. This is another case of diabetic foot. This 64 years old male patient with already amputated great toe, and he was referred for ozone therapy by orthopedic surgeon. The soft tissue seemed non-viable, and vessels were also not in good condition. As evident from the images, the surgeons had planned for mid-tarsal, mid-foot amputation. I requested to wait for another 5 sessions. I am sharing image. So what they told, we have referred. Listen, Dr. Bush, we have referred this patient for circulation, not to avoid amputations. So I request him कि ऐसे भी आप तो काटने वाले ही होने हैं, तो give chance for 1 week. So he convinced and he given me chance to for this therapy. After 5 sessions, he advised to continue the same for more sessions. After 11 sessions, healthy granulations was observed. Only partial amputation was done and second toe was removed instead of midfoot. Rest of limb was saved. I am sharing image. This is the report of the this patient. So color Doppler and you can see there is a monophasic way, no circulation at all. This is the inflammatory stages before treatment. This is the after some session. This is tissue remodeling stages. And believe me, during treatment of diabetic foot ulcer, so it is really challenging for doctors as it is a foul smelling and odor is so unpleasant. So after giving this therapy, I am not able to take my food for few hours. It is so foul smelling, and sometimes I am feeling nauseatic also. But when I see his or her amputation can be avoided, surgery is avoided, and tears of gratitude and happiness in their eyes, that time I feel that I am very much blessed and I forget everything. So it is my passion. This after some sessions, wound becomes sterile by ozone and conventional treatment. They suture the wound, and this is a maturation stages. You can see it is quite evident it is a scarless healing. Epidermis to epidermis, dermis to dermis. So no adhesions at all. So what type treatment I have given that I showing this patient. Surgical debridement and partial amputation by surgeon, antibiotics according to culture and sensitivity, ozone bagging, rectal insufflation, ozone injection around the wound. I am also giving a ozone injection around the wound subcutaneous to improve the circulation, IV vitamin C. And Ayurveda medicine, Sariva Manjishtavati, Raktapachak, Arogyavardhini, Sadhatatrut, heal appointment. Diet based on Ayurvedic principles. So you can see this is a patient of diabetic foot ulcer. He, he was the patient is South Indian and some marriage function was in his family. So he neglected that this wound and not treated and enjoying his celebrations. So what happens? I am showing. This is the wound, non-viable tissue, foul smelling. He came to me on these stages. Uh, he referred to me from by some doctors from Sign Clinic. So I have advised a very much false non-viable tissue. You can see toe is almost gone. First finger is black. So this is not my cup of tea. I am giving you first treatment to just maintain the wound. You straight away you should admit in the hospital and you should debride the wound. After that you can come to me. So we should be transparent with our patient. Uh, and we should advise them properly. So where ozone does not work, when ozone work, that we should know, need to know. Because I have done duty in surgical ICU, so there I have seen lot of surgical patient, and based on this experience, I making my own protocols, and I'm doing this treatment. So I told them clearly, okay, you should go admit in hospital, debride the wound, then you come to me. The patient is staying at Sion. This is the non-viable tissue images with lot of foul smelling. After debridement, again they came for this therapy. They have lot of faith in this therapy, lot of faith in me. This is stages 5. Stages 5 healing. You can see it is quite evident. You can see here exposed tendon, exposed bone, uh, tendon infection also. It is very difficult to treat tendon infection at OPD level. But I took the risk because patient is very bold. वो बोल रहे कि नहीं आप ही करो जो भी करना है आप ही कर सकते हो. I don't want to go there. They will amputate below the knee, below the ankle. So I want to save my limb. So this is the improvement. Slow but steady. It took almost 4 to 5 months. These are the report of arterial occlusion in right lower limb, affected limb. This is the latest image of last week. So I told this patient, now patient is coming to me every 20 days. So मैंने बोला कि last image तो आप share कर दीजिए, तो I want to present this case. So you can see the whole limb is saved. Only one finger is amputated. So this is the integrated approach. So when patient comes to me, so what I do, I evaluate patient. I see thoroughly patient history and counseling. Then I apply my existing science, lifestyle modification, nutritional diet and yoga is also integral part of this tissue healing. Dressing and offloading is required extremely. So in ozone therapy, I am giving ozone bagging, micro injection of ozone for wound healing, huh? Rectal insufflation, ozonated saline, minor autoimmunotherapy, major autoimmunotherapy. In Ayurveda, I am using that all medicines. You can add more and more into this list according to expertise, according to your experience. This is only symbolic what I am using in Ayurveda for wound healing. This is in nutrition, IV vitamin C, Myers cocktail, IV glutathione, oral alpha lipoic acid, vitamin C, B complex, etc. Local application, Ayurveda Satadodgrut, Jatyadigrit, Tel, Panchagavyagrut, Gogrut. Here also you can add more and more drug. You all are expert in Ayurveda. You can add according to your experience. This is allopathic. I am also using allopathic. Um, my approach is always patient oriented, not pathy oriented. What is benefit to our patient that we should have for them. So I am using all these dressings also according to patient's condition. And I like this slide very much. So I'm putting in each and every presentation. If your doctor prescribes your medication without first asking you about your diet, your sleep, your exercise, your water consumption, or the stress in your life, then you don't have a doctor, you have a drug dealer. I like very much this quotation. This is my research work, ozone therapy in multiple disabled children. Now, summary. Golden rule for this therapy: start low, go slow. There is no age bar for this therapy. This is simple OPD procedure. Patient can continue their routine immediately after this therapy. Ozone is a complementary integrated approach that can be shortened period of recovery and cost effective. Ozone can be combined with any science like Ayurveda, allopathy, homeopathic, naturopathy. Ozone is contraindicated in G6PD deficiency, organ transplant patient, first trimester of pregnancy, thrombocytopenia. So this is the another side of ozone. There is every science has a some scope and some limitations. So these are the limitations. Ozone does not work in dry gangrene. Be transparent with your patient and use ozone precisely. Thanks to Ozone Forum of India, Dr. Mili, Dr. Jignasha, who teach me the ozone, Venus Medical Center, where I am practicing, Sri Sai Hospital. They are referring patient to me and they have faith in me in this therapy. Team CleanSave, Dr. Hima Madam, Dr. Snehal Makwana, Anand Sir. Thank you. You can contact me in person if you have any question. So this session is open for question and answer. Sir,
Yeah, thanks a
I
lot.
have done with
Thank you
my
so much. Yeah, thank you so
I
much,
have
Dr.
done my
Rajesh.
session. Huh?
Sure,
Uh,
ma'am. Yeah,
uh, we
thank
are
you so
very
much,
much in
Dr.
time, I
Rajesh.
think so.
Yes,
We are
ma'am,
very much in time. Huh?
definitely.
And I will
Uh,
not bore, I understand.
ma'am, you can still add your even more points from your experience in case if you wish to. Um,
No, sir. No,
but if
sir.
you want, we
It's
can go ahead with the
sufficient.
Q&A.
Yeah.
Okay,
Huh.
okay,
Yes, yes.
sure, ma'am. Dr. Rajeshwari, thanks a lot for the insightful and enriching presentation. Your experience and knowledge have helped us with a deeper understanding on how ozone therapy and Ayurveda for wound management can be helpful to all the doctors present here. Before we conclude, I would like to open this session for a Q&A for questions. Please feel free to raise your hand or type your question in the chat box and Dr. Rajeshwari will address them. The Q&A shall be hosted and managed by Dr. Snehal Makwana.
Yes. Good evening, everybody. Amazing session, ma'am. It was an eye opener, especially for the wound healing, crush injuries, diabetic wounds. I agree with you. The diabetic wound is like so much. The stench, the smell is so much strong that you cannot eat after dressing it. I have been in that OPD and doing the dressing. But the amazing work with the ozone therapy, I really appreciate. And the data, specifically data, pictures, all the way you have presented with the data, with the proof of effect of using ozone therapy with integration with the other, all the medication which is required. So it is really wonderful. Any questions, any queries you have, you can put it in chat box. Ma'am will answer it, or you can raise your hand and you can ask the question. I feel the session is so amazing. Everyone is mute. No one has any queries. So, but I would add this one, ma'am, that what
Huh.
I got through your session is one is the institutional based approach is required when there is a complication like crush injury and severe wound and kind of thing where gangrene
Yes,
is
yes,
there.
yes.
We should be thankful to the Sri Sai Hospital, which is giving you an opportunity to work with them and take
Yes.
the cases in this kind of condition. And second is the consent, I would say, that is required in such patients, such complicated patients, that you are using these things and you must be taking it, right?
Yes.
Yes, Dr. Sheetal has, I have heard about ozone hair oil for hair fall and dandruff, etc. Is it true about
Yes,
ozone hair?
ozone hair oil is already available and it is a
Okay.
fantastic result in hair fall, hair loss, and hair pathology like seborrheic dermatitis, psoriasis of scalp psoriasis, and any other infection, viral, fungal, and bacterial. It's very good because ozone has a property of antiviral, antifungal, and antibacterial. So it covers all type of infections.
Okay. Wow.
So it is
Uh,
available, huh?
okay. Next question is from Dr. Dhwani. Ma'am, have there been any cases where there was any allergic reaction to the ozone therapy?
Not much. Only one side effect in 1 lakh patients. It is very negligible, like drying of skin, weakness, generalized weakness, sometimes feelings nauseatic, nothing else, and coughing. But it's all are transient and not dreadful side effect, I can say. So if we use it judiciously, here conditions is applied. So we use judiciously, then there is no side effect at all. Okay.
Correct, correct. And again, the question is from Dr. Sheetal. Do you conduct lectures for DRS to learn ozone therapy?
No, I am not conducting. I am not the person who can conduct, who are conducting ozone training program, but it is already done at Bisleri Charitable Trust every 3 or 4 months. Now, at tomorrow, 21st to 25, advanced training program for the doctors. And doctors are coming across the India and out of India. There is my half day sessions tomorrow for dressing skill. That is another angle. So I am teaching them from scratch to dressing, how to apply dressing, what to do, what not to do, which type of wound, how can application apply ointment, other therapy, how can we integrate it. So everything I am teaching over there, and my session is 2.5 hours. So I am giving live demo also how to trace the wound, various type of wound.
Wow.
Okay,
Okay.
so it is already there at Bisleri Charitable Trust.
Okay. Next question is, how can we procure these products, these machines?
Again, I would say Bisleri Charitable Trust.
Okay.
There is a
Uh,
the ozone clinic over there. They are conducting lot of training program. They are making all this product. You can procure from that person, Dr. Jignasa Captain. She is a
o-
director of Ozone Forum of India.
okay. And the oil which we discussed earlier, where
Mm.
the oil will be available?
There only, sir.
Okay.
I am procure from there only.
Okay.
There
One
are so
stop.
many products: ozone rapid heal, ozone hair oil, ozone balm, very good effect. Ozone pain oil, miracle to reduce wrinkle, blossom for moisturizing cream. And they don't use any chemicals. It is a natural. So we need to keep in fridge. It is so natural and very good effect. I am using almost all products.
Wow. Okay. So next question is from Dr. Praveen. Can be used for regular wound healing to make the healing faster?
Yes, definitely. You can use it. You can shorten the period, faster healing, and it is cost effective too. You can treat wound at bedside also. I am sharing a couple of images that is done at bedside. So it is so versatile therapy. So you can use everywhere.
Is ozone therapy works in malignant or cancerous wounds?
Yes, definitely. It's an anti-cancer agent. Because basically ozone is what? It is enhanced antioxidant defense mechanism in intracellular level. So it is always dose dependent. So it is always not only ozone, ozone in microdose, mainly ozone oxygen combination. So it at the same time when you apply ozone through systemic approach. So what it done it is 10 time ozone is 10 time more soluble in water medium, aqueous medium than oxygen. So instantly it dissolve in plasmic water and making some RO gradient of ROS, lipid peroxidase, which is antioxidant, which everybody has it. So it is boost up the antioxidant defense mechanism at the same time. So which is bad cell. What are bad cell? Bacteria, virus, fungus. They doesn't have antioxidant covering. Okay, so it is exposed to the ozone, and the liver life form bacteria, fungal, and virus doesn't thrive in aerobic medium. So at the same time, it boosts up good cell and kill the bad cell like bacteria, fungus, and viral. So it's a really versatile and smart molecule. So double double benefit.
Okay. Next question is, after first session of ozone therapy, after how many days would be the next follow-up session? So gap between two sessions.
Depending on the condition of the patient, depending on the condition of the wound. If wound is infected, oozing, lot of oozing, severe tissue loss, so we required daily therapy. Then gradually we are decreasing. So I have shared South Indian patients. So first 2 months I have given every day. Wound is so bad, was so bad. Every time I instructed the patient, you should go for skin grafting, but he was not keen to do it. So ultimately, I had to do it. I have to do it, and now it almost 95% healed. So that is another story. But gradually we can decrease the dose of the ozone sessions. And another for varicose vein wound per se. So varicose vein wounds, we achieve proliferative stages, then we can give 4-layer dressing. So that is another angle of the dressing. Okay, so always we can shorten the period according to patient's demand, conditions, economical conditions, distance, etc.
Okay. And trust you are saying is at Andheri Chakala, Bisleri
Andheri
Trust?
Chakala, Bisleri Trust, yes.
Okay, perfect. And other question from Dr. Anju is, how much is the cost per session for the patient?
Oh, ये अंदर की बात है. According, according to expertise, you can charge it. Patient never mind. Well, if you save his or her limb, you save her plastic surgery and surgery. So they can charge whatever you say, whatever you demand. But yes, be transparent with your patient. If patient is not affording, so we can do in peanut price also.
Yeah, perfect. So everybody, thank you for the session. Thank you for the question answer. If you have any last question, last two questions we can take. If you have any
Yes,
question,
yes.
otherwise we can complete the session. Anand, over to you. I feel there is no more question left.
They can contact me through WhatsApp in person. No issue. If they want more information about the same, okay, I am ready to help.
Yes. Dr. Sheetal, as ma'am has said, I would translate it in other language that consultation of the doctor changes as the doctors become senior, right? So same way with your expertise, that you can charge according to as you have asked for the question. One more question, ma'am, is someone is
Mm.
typing. Let's wait for one more question. Can it be given in healthy individuals for preventive aspect like Rasayan Chikitsa?
Definitely, it's a preventive, protective. You can add more and more adjective to it because it is Yogvahi. It is a natural drug. It doesn't have any side effect. Like we breathe, we do pranayama, we do yoga. Like that, we can take ozone. It regular basis for healthy individual also because it boost up your immunity. It improve your energy level and rejuvenating, anti-wrinkle, anti-obesity agent, muscle toner, a good antioxidant. Now is the era of antioxidant. The, many of our patient, our relatives, our celebrities are taking glutathione. vitamin C for anti-aging treatment. But this is 100 times better than all these things because it enhance your own antioxidant defense mechanism at intracellular level and which making glutathione. So it is a very miraculous molecules, I could say. You can take it for rejuvenation, for rasayan. Or another plus point is that panchkarma, it is a time-tested remedies. We can't compare panchkarma with ozone therapy. But yes, there are a lot of patients, we can't afford panchkarma. They can't follow pathya. They can't come every day. For that, second line, ozone is the best molecule.
Wow. Okay. And for if we are opting for Rasayan Chikitsa,
Mm.
duration between the two sittings would be in healthy individual.
In healthy, uh, alternate day or thrice in a day. There are various therapy. Per se, if we are giving rectal insufflation, so at least 2 to 3 days session per week is necessary. But we
Okay.
are giving major autoimmunotherapy, so it can be given every week, ozone bath every week. So it is not comfortable with patient to come every day or every alternate day. We can introduce with the major autoimmunotherapy or ozone bath, ozone saline. Okay. Once we introduce this therapy, it reach to the cellular level, and our RBC life is 120 days. So 4 months ozone effect is always there. But what we are giving maintenance dose every 15 and every month to reach maintain the plasma level antioxidant defense mechanism. It is like that. So it depends. So first we need to evaluate the patient and then we can advise. We can offer them Ayurveda, ozone, IV nutritional, various treatment depending
Okay.
the condition of the patient.
And have you seen anti-aging miracles on skin as compared to Botox, fillers, and plastic surgeries? Does
Yes,
ozone therapy help in obesity? And when compared to liposuction? So I've combined all three questions together.
definitely. It's a natural drug. It is anti-wrinkle. So if we compare to Botox, it's 100 times better than Botox because Botox we paralyze the muscles and we need to take a maintenance dose also. The ozone
True.
is a natural drug. I am giving lot of micro injection on face to reducing the wrinkles. I have many celebrities who come for these micro injections only. So your facial expressions remain same after this treatment. Unlike Botox, you can see after Botox, facial expressions is restricted. I have seen in many celebrities, but with ozone, it doesn't happen. And another benefit is that uh, if you take Botox, तो like आपने उससे शादी कर ली, पूरी जिंदगी आपको मेंटेन करना है. When we are giving ozone, so you can कभी भी आप बंद कर सकते हो. There is no harm at all, no any adverse side effect at all. It is a good muscle toner, so it is a wrinkle reducing also. If I can say okay, with only with ozonated water, it's a simple device. Take a 1 liter of normal water, aquaguard, and ozonate it for 10 to 15 minutes, and then you wash your face and see the result. मुझे कुछ बोलने की जरूरत ही नहीं है. You can experience it. It's like a facial energy drink.
Amazing. Okay. Mm, I guess all the questions have been covered, ma'am. Uh, Anand, you can take over from now. The question
Yeah, I
answer.
think there was a, hand raised by Dr. Parul Sahiba. I've allowed the mic for her.
Yes, yes. She's my best friend and she's my guide also. Huh? She brought ozone
Yes.
therapy from Malaysia. So I am very really blessed, really blessed that Dr. Parul ma'am is over here. So I am very fortunate.
Excellent results,
Yes,
Dr.
ma'am.
Rajeshwari. Congratulations. I have been
Thank
practicing
you.
ozone also, but I have never seen such wonderful results. Keep it up. Thank you.
Thank you, ma'am. I am really blessed.
No, no, nothing.
Uh,
Thank you, Dr. Parul. Okay, so we'll be closing the Q&A here then. And thanks to everyone here for your active participation and engaging questions. We hope you found this session very valuable and informative. Once again, a big thanks to Dr. Rajeshwari Buch for sharing her expertise with us today, and thanks to all the participants for joining us. We look
Thank
forward
you
to
all
seeing you
delegates.
all in our yeah in our next Gyaan Vardhini session, which is scheduled on 24th of September to be conducted by Dr. Umanka Verma Ray. The topic is Panchakarma Perspectives for the Management of Obesity or Sthalia. Thanks once again, and we'll be closing the session here. Thank you, ma'am, for the
Thank you for
wonderful
patience
session.
listening,
Yeah,
all delegates.
yeah.
Thank you, thank you.
Thank you, ma'am. Yeah.
Okay.
Have a great day. Bye.